Good afternoon, everybody. It is Friday and the 4th of February. You're here at Lunch and Learn. As you know, today we have a guest speaker, Dr. Nicole Cunningham. She's been a homeopathic doctor for the past 20 years, and for the last 13 years, her practice has been exclusively online using telehealth. Her specialty includes heavy metal toxicity, and we've talked about that here many times. So we understand that, and she works with children on the autistic spectrum and women's health and autoimmune diseases and several other sort of issues that she will talk to you about. I'm going to have her give you a little bit of her own background. So she did a presentation for us a couple of years ago, not quite 2 years ago, and now she's going to give you an update for us. So Nicole, thank you so much for being with us. We know how busy your schedule is. We will keep you on time so that you and others can get to their 1 o'clock appointments. And thank you for being with us. It's all yours.
Thanks for the invitation again. It's really fun to actually share and share what we're all learning clinically, because this pandemic is very much the data is being collected in real time. So I do appreciate the opportunity. My background is that I am an MD, but I've re-specialized to move into integrative and homeopathic medicine. And it's funny how you look back at your career and you realize what it is that you used to do and the things that have come into your opportunity and the things that you've done. I worked in a homeopathic hospital in Mumbai in India, and I now understand why. Because I'm now seeing cases that I never would have had exposure to in the West, but it was back then. And this is where really, when it comes to the Delta variant, we had some very scary clinical presentations. But because of the work I'd done in India, I can now in hindsight think, okay, that's why that fell into my life and I had that opportunity. So I'm going to be explaining the things that I'm seeing clinically, but I just want to put a caveat out there to say that a lot of this is not based on clinical trials, because the trials are not being done. The data is being collected in practice. I'm one of several groups, one that I'm very active in, which is groups of integrative and homeopathic doctors worldwide. We meet via a Facebook group, and we have Zooms twice a week where we actually collate clinical data and share remedy responses and really get the assistance from our colleagues. So a lot of that data is going to be in my presentation today. And then similarly, I then continue to practice virtually in cases in a homeopathic hospital in India, in Calcutta. And I do that once a week. And so I'm going to be drawing that into my experience and in my sharings today. So I want to start by giving you a brief synopsis that the clinical presentations of each of these disease and variants is the most important thing. And particularly when we're talking about an integrative or homeopathic approach, it's actually the unique presentation versus the epidemic presentation of the disease. So I explained that when I was here last time, that Hahnemann, who's the founder of homeopathy, had a very, very long history, over 200 years of treating pandemics, multiple pandemics in his lifetime. And we have a lot of data, which is our clinical trials, our provings to go back on. And so many of us have been using that, and even there's specialty homeopaths who are not doing any clinician time with patients, but instead using their research and their stewardship in the data and the books to actually help bring light to this pandemic. I want to talk about treatment specifics for the variant, the long COVID, or the idea of that these spike protein cell damage, and that's actually been the biggest thing I have personally, I believe, is the biggest and scariest thing about the SARS-2 virus, is this spike protein cell damage. And then what do we do in the face of this epidemic that's not going anywhere? And then we'll open it up for questions at the end. So COVID, as we understood it, when it first came out and was first identified, in my practice, it was November 19, but we didn't understand what it was. But at the time, we were not getting that bothered by it. We were treating the simillimum. We were giving the patient the unique remedy that was specific for them, and we hadn't yet really understood that we were dealing with a pandemic or an epidemic. So the typical presentation of that was just a respiratory disease. It was just an acute respiratory syndrome. A lot of us thought that it was influenza 2 and that maybe this was just a very severe strain of influenza 2, and we were treating accordingly. And it wasn't until we understood that it was a pandemic that we started to realize, okay, we have to prepare ourselves for multiple waves of this. And as most viruses, the presentation has been very typical in that the first and second waves have been more severe, and that over time, because it becomes less severe, we have a better opportunity at achieving herd immunity. So coronavirus, when it first presented, it was slow onset for the old and fast onset for the young. And a true definition of an acute illness is that it comes on fast and it resolves fast. It never really slid into the category of chronic disease because we hadn't seen that there was an issue with convalescence. We're starting to see that now, and that actually it was linked to Alpha. It definitely is linked to Delta. And what we're seeing now in terms of Omicron is that perhaps it's an acute exacerbation of the chronic illness of those who have experienced Delta. So we didn't really feel that we needed to have anything to be concerned about, and that ultimately pharmaceutical medicines and hospitalization wasn't really going to be part of the picture. It wasn't until we reached into the thick of Delta that we realized we actually had a problem. And so to this day, I've had going on 3 years of doing this. I've not had a single case require pharmaceutical medicine or hospitalization because I'm using high potency medicines frequently. And this is what is done in the homeopathic hospitals in India. It's not particularly mainstream in the integrative or homeopathic worlds here in the West, particularly not America. They're very Hahnemannian and classical, but I reached on those principles and the methodologies in India, where you have about 3 hours to clear a hospital bed because it's a hospital setting. And so you have to work hard and fast. So that's what I use in my practice. It's not one dose and wait 3 days. And those of you who have had perhaps homeopathic consultation or experience in the past will know that it's often only prescribed as one medicine at a time that treats the patient. This is a very different and far more aggressive way of prescribing, which is multiple remedies treating different levels of disease diathesis, and therefore we can actually provoke or stimulate the vital force to actually get a resolution. So as such, we haven't had in our practice the pharmaceutical medicines being used apart from for long COVID, which is based on relationships with other doctors because of the spike protein damage. And then the hospital cases in India, because we have to deal with patients who are already on ventilation and we have multiple IVs to consider, we use low potency medicines, but they're still used in very high frequency and repetition. So Alpha was lung COVID, and the ones that we were concerned about in practice were the 40 to 60-year-old adults. It was considered moderately severe, and it affected the people who were ill already, which is why the nursing homes and the people who were in hospital were the most at risk. When the world shut down and we started getting isolated and we started putting those precautions in, we very quickly saw that this was the age group who was actually ill. It wasn't through exposure of young people, it was people who had exposure who were older people. And so those who it did create morbidity for had 2 or more adjacent comorbidities, which means that they already had hypertension, they already had vascular diathesis, they already had circulatory issues, they already had a compromised immune system from an autoimmune diagnosis. And so we treated them as a subset who have then become the sliding into, and again, hindsight's taught us that this is slided and these patients have slid into the long COVID just purely because of the spike protein damage from the virus that then complicates their entire picture. And so the other patients who did not have those things, typically they were only unwell or in bed for anything from 2 to 6 days. And it was a fast remedy response, even if it did hit the lungs. So the presentation was fever, cough, sore throat, loss of taste and smell, a runny nose, fatigue, mild body aches. That's a one to remember, the mild body aches. And then some shortness of breath. If we could treat it in the first early onset, the prodrome, which was from day 2 to day 6 with the correct prophylactics, which was what I talked about last time I was here, it very rarely moved on to the second stage of disease, which was where we started getting fluid in the lungs. Delta has been the hardest so far. It truly has been the scariest, and the hospitalizations were high. It first started hitting my practice around March, April 2020. Again, I didn't know what it was. At the time, I was trying to understand what it was from a spike protein perspective, and because it hit really sudden and it was very severe and it progressed very, very quickly. It included some respiratory diseases, but the double-sided pneumonia was the most alarming, and that happened to almost everybody, not just those who had the comorbidities. It was multi-system, and the patients in my practice who took the medicines, again, high potency, high frequency, were unwell and in bed from 5 days to 3 weeks. And that for a homeopathic patient, that's actually a very slow remedy response. But what we noticed is that every 3 days, we needed to change the frequencies of medicines. So we needed to change the potency and the frequency of dosage, because the spike proteins continued to just replicate, and more cells were being affected multi-system. Whereas previously, our understanding of COVID was that it was just an acute respiratory disease. We didn't understand that the fevers were going to go on for days at a time because of the viral load, and that the excruciating and debilitating joint pains, this was perhaps the worst symptom for many of us who experienced it. It had the gut involvement as well, with nausea and mild diarrhea. Most of my patients were unable to eat for 5 to 6 days at a time, even if they had got rid of the fever and were out of bed. But there was a heaviness in the lung and a difficulty breathing, but it wasn't as severe as a shortness of breath. It was more a heaviness, a feeling that there was an elephant on the chest. And we realized after the fact that this was the spike proteins creating damage in the vascular system. The legs were greatly involved. I had a lot of spontaneous blood clots. I had a lot of spontaneous bleeding and rupturing of blood vessels in the kneecap and the legs, even on the hands. And these were scary symptoms that we had not seen previously. The dry cough and the respiratory issues were almost as concerning as these blood clot and vascular issues. And this is where a lot of patients were hospitalized quickly because it looked like a cardiac or a stroke episode. There were neurological things that were starting to present after the first 4 days of onset that included memory loss, disorientation. And a lot of my patients were really, the fear of death was very high. They'd never experienced something that was so debilitating. We had seen cases this debilitating, but with less systemic involvement in India with alpha, but we put that down to the sheer realities of living in an Eastern country like India versus the West, where we have more comforts and things like that. But this was something that really started to get us concerned and realize that people were going to be affected by this long term. This is not just going to be a horrible 3 weeks, but ultimately what were the consequences of this long term. Omicron, by comparison, we're seeing now, and you mentioned before, I think it was you, Aaron, that there's a new stealth variant. Again, I'm watching this as the new one and learning as we go. But as far as my clinical approach at this point is, Omicron is the new variant. It's affecting the 30 to 50-year-olds with the most symptoms. And children and adults 70 to 90 may have it. They may even test positive on a PCR or a rapid test, but they actually are very asymptomatic, to the point where they don't even know that they have it, but they screen anyway. Perhaps it's part of school attendance or diligence in the workplace. And so they do actually test it, but they're completely asymptomatic. It's 3 more times infectious, as we understand it. And people are very quick to recover. And it's not really even feeling worse than a cold. The first presentation of symptoms is a dry, itchy, scratchy throat, and that's the last one to leave. So that's a nice little keynote for us to be able to understand where the differentiation lies. And the post-infection lethargy, is really the thing that's bothering people the most. It can take up to 2 weeks for them to feel like they're back to their normal self and back exercising and cooking 3 meals a day and able to tend to their life like they did before. But it's severe pathology, but the presentation is very mild. It only presents like a flu. It doesn't have the shortness of breath. It doesn't have all of those lung symptoms. It's just an upper respiratory infection, like a cold. So it's an ear, nose, and throat. It's very much sitting there in the head. And most patients are experiencing a very mild loss of smell compared to Delta. Again, Delta, the smell was secondary to all of the vascular complications, but it was still a problem for patients. Alpha was the one where they lost their smell and they were bothered the most. So it's a very small part of the Omicron presentation, and it's more the congestion in the ears, the tickling in the throat, and a feeling of perhaps a sinus infection coming on, or an ear, nose, and throat post-nasal drip. So going through this illness, I think it's the least detrimental in terms of the multi-system being affected. It's a short, quicker resolution. And so this is the one that I really think we have the opportunity, because of its infection rate, and there's a very low suffering by comparison. This is the one I'm encouraging everybody to get. I'm encouraging people to go out, get the antibodies, because I believe that this will be the one that gives us a chance of true herd immunity. So in terms of the medicines in treatment and the approach, when I first started, we were doing the prophylactic treatment for alpha, because we were learning that it was high risk for people who were high risk, and so we wanted to make sure that we were protecting the populations that matter, so and those who had high exposure with those people. So I was very much in the mindset of prophylaxis, and so the Metarhinum and the Arsenicum protocol that many of you did was definitely something that I was passionate about, and I was trying to get everybody on that. It was suitable for everybody because we didn't really understand it. Now my approach is different when it has come to Omicron, and I've realized that those who did get alpha have the long COVID, and so it's a matter of, well, we can't protect forever, and so it's better to get some versions so that we do have some level of immunity. And I know that's probably controversial. Obviously, I'm not talking about people who are high risk, who have autoimmune disease or multiple diagnosis, cancer, history of cancer, things like this. But if you're a mum and pup, middle of the range, and you have kids and grandchildren that are in your life, I think of all the times that it's to get this thing and to actually get some immunity, this is definitely the one so far that we see as least disruptive, and it's not multi-system. It has more advantages than disadvantages. Now, what's interesting is now we've also got this understanding that we're living in this pandemic world, and so there are psychological and psycho-emotional consequences, which I'm sure you're seeing in your practice as well, particularly a lot of you are working in the mental emotional realms of social work and neurofeedback and psychology and psychiatry. I'm noticing more and more that there's this almost a collective consciousness of pandemic and epidemic living, which is a big part of the disease diathesis for acute illness. So as much as I'm treating people in practice for, I guess, different bearings of pathology and diagnosis, the overshadowing emotional condition and psycho-emotional remedy picture for these people fit into 3 different remedies. Aurum metallicum, which is the apathy, indifference, motivation. There's no point. Life has no meaning. I've had everything taken away from me. So that's one of the presentations. The second is the Arsenicum album presentation, where there's great fear of illness and death for themselves and others. These people are often addicted to watching the news every day, being on top of the studies and then the statistics every day. And these people feel great anxiety in the state of the world at the moment. And a lot of these people have experienced one or multiple variants of COVID. And so as a result, it's an exacerbation of that acute state. And then the third one I'm seeing is NatMer, which is a very grief and depressive state. It's more a low state than a manic depressive with any highs or lows, where there's just disappointment that my children have not been able to graduate, disappointment that my parents are no longer here, disappointment that things didn't happen the way they should have. And so there's this overlying grief, indifference, and resentment piece that presents. So when we're treating an acute physiological presentation of whether it be Omicron or when it was Delta, we were often using these remedies intercurrently to shift the mental emotional state so that we actually had engagement from the patients. And this was something that me and another doctor in Europe were the first who said that I'm willing to take it on in terms of the clinical data. Everyone was very resistant and they were saying we're just going to stick to the physiology. But I had people who had a lot of faith in me, a lot of faith in homeopathy and homeoprophylaxis. And so when they did end up getting this thing, there was a sense that they had been wronged. And so that became such an overshadowing part of their healing process that even when their remedies got them well physically, and I'll go through my protocols in the next few slides, I couldn't shift them out of this emotional state. And so on one of the Zoom calls that we did, I presented the idea that maybe there was this pandemic collective consciousness emotional state that we actually needed to use as intercurrents. Since then, a lot of my colleagues have taken on these three remedies as prophylaxis moving into this new world, as I am in my practice. And I'm noticing that particularly with Omicron, the patients who I've had these remedies going in as intercurrent or just a few doses a week remedies, when they have experienced Omicron, they've taken it as a lighter approach of, okay, that's all right, it's just a bit of illness, but life can continue, as opposed to this doom and gloom and despair of recovery. And so it's just an interesting thought. Again, this is all anecdotal, it's all purely in my clinic. But when you have people who have trusted you with their health and they feel like you've let them down, or they feel like their health has let them down because they take all these supplements and they're well, healthy people and they got sick anyway. It was an important part of the disease diathesis for me because it was incredibly it was difficult taking the toll on me personally as well in my practice to listen to this every day. So I started to look at it more as potentially part of this disease presentation. So I just want to throw that out there as something maybe to think about. So we treat now the pandemic as each case being differently, but also the same. So we look at the mental emotional similarities, like I've just expressed, and then we also look at the multi-system and the clinical presentations, and we give remedies according to their individual and unique expression of the disease diathesis. So to give you an idea, in a few slides time, I'm going to give you my protocols purely for physiological variant prescribing. But within that, if the remedy response was not quick within 20 to 30 minutes, we would retake the case and look for what is unique about this shortness of breath. What is unique about the pains that they're experiencing in their legs? Are they tearing pains? Are they heavy pains? Are they bruising pains? Are they in one side versus the other? And so there was still a lot of experience needed in the speed of prescribing. So I don't believe as of yet that we've really found the remedy, the genus Epidemicus of COVID, because we still are learning that the variability within prescribing is still unique and people are needing individualized remedies. So I'm going to give you here what works for probably 70% of cases. But if it doesn't work, then you just need a homeopath to prescribe, just tweak it slightly and things will really speed up, because you really should get a remedy response for COVID within 7 to 12 minutes. The patient should start feeling like something's moving and moving in the correct direction. So Hahnemann, just as a reminder, Hahnemann was the founder of homeopathic medicine. He was a physician and pharmacist, and he discovered homeopathy as he was disillusioned with the drugs being utilized at the time, aggressive things such as arsenic and and bloodletting and very invasive procedures. And his organon of medicine has really taught us about those pandemic diseases. So as I explained, there's a few homeopaths who have really done a lot of studies and written a lot of papers on this organon of medicine. So we're leaning on our colleagues who know this inside and out, to give us the clinical data about what he used, particularly in his malaria, cholera, and typhoid pandemics. The genus Epidemicus that is closest to the ones that have been done in the past include the Arsenicum, Veratrum, Camphor, and Carboveg. So these were epidemic remedies used back then that are then starting to show up now. So I want to explain here in my repertory. So we have homeopathic software that does this for us now. We're so fortunate compared to the homeopaths, 40 years ago who didn't have this technology. So with every case, we put in the patient's symptoms, which is the process of case taking from the patient, and then we put it into the software that shows us the best remedy matches according to those unique symptoms. So the Arsenicum, Camphor, Carboveg, and Veratrum very much shows up in the collective symptom totality for most of our patients. So that's what we found was really interesting, because that is the same collective data as what was done with the epidemic research and in the organ of medicine. So what's different though is the genus Epidemicus that's in India and Africa, they use camphor, and here in the US and Europe, and what I'm using in Australasia, which for me and my practice is Singapore, Australia, New Zealand, it's different. Because, and I really believe this has got to do with the socio-economics and the environmental factors. People in India and Africa have to often travel days at a time to get to medical facilities, to homeopaths who can help them, or even just to mainstream hospitals. And so therefore they have a lot of greater severity in their clinical presentation. I also think that their miasmatic pictures are completely different because they live on a different level of microbiome in their gut. So they are used to more variability of bugs and infections and parasites and things like that than what we are in the West, which is why I think camp is a better match. When we first started to look at these remedies, people in Europe and a homeopath in Australia was starting to use camphor and getting nowhere with their prescribing. And so this is where this differentiation has started. It was back in alpha. So that's where I got Arsenicum album as my prophylactic remedy and also my treatment remedy for alpha. So it treats the restlessness, the fear, and the anxiety of disease and dying, the fever and the chills, the malaise. It has all the respiratory issues, and then it also has a big gut picture, which is why it was also relevant as one of the prescriptions in Delta. So as a prophylactic, we did the Arsenicum in a 10 morning and evening, and then we would do that in first exposure, and then after there was a positive test or one person in the home or in the environment was symptomatic, we'd increase to hourly and then half hourly according to the severity of symptoms. And those who were high risk of severe lung complications, we dialed up to every 10 minutes. Now this is important to note that we didn't start with Arsenicum 10M. It's considered a high potency in homeopathy, even in the most, clinical of settings with people who have a lot more experience than I do. They were starting with 6C, which we thought was physiological potency because we thought that this was physical manifestation only. Because Arsenicum was such a great clinical match emotionally, we very quickly realized the higher potencies had greater impact. So for alpha, we used the Arsenicum album and we did the Thuya 10M to reduce transmission to others, and the Meteorinum was used as the prophylactic for prevention. This was good, but as we moved into Delta, we realized it actually didn't have enough systemic multi-system coverage. It didn't treat all of the ecchymosis and circulatory vascular issues that was part of the spike protein disease progression. And so we quickly had to add in more remedies. So for Delta, we treated Arsenicum 10M for the fever, chills, and viral load. Bryonia was the only medicine that got on top of the raging body aches and pains. And anyone who is on the call today who had Delta can attest. We had Delta and it was incredibly painful. I'd never experienced pain like it, tearing in the limbs, to the point where you felt like your muscles were being pulled off the bone, just agonizing, tearing pains in all hours of the night, and the raging fevers that went on for 2 weeks. The dizziness, the circulatory complications, and the disassociation also were part of, and the tachycardic, there was a lot of irregular heartbeat that the Bryonia covered. Ipecac helped to bring back the appetite and stop the feeling and sensation of needing to vomit. The Thuya was put in as a prophylactic to protect others in the home, and this did work very well. We had a lot of success in my practice with stopping teenage children and other adult family members from getting Delta, and so that I felt was very successful. I'm proud of that one because it was wonderful to have only one family member suffering, not the whole house going down, which was different to Alpha. And Carly Bish was moved in when we started to understand that the double-sided pneumonia was a big complication. So Carly Bish 200 was the medicine frequency, the potency that worked best for a lot of the high-risk respiratory emphysema cases, my patients with lung cancer, and with Carly Bish 200 and Thuya 10M and Arsenicum 10M, those three in every 7 minutes for the first 4 hours, and then we pulled it out to 1 and 2 times an hour. That many times was the protocol that stopped hospitalization. So now we find ourselves in Omicron and the picture has changed again. We continue to use the genus Epidemicus of Arsenicum album, but we've also introduced 2 new medicines, belladonna and Kali Mur, and the Carly Bish and doesn't have as much of a role to play because we're not seeing the thick congestive liquid and mucus on the lungs. So I use the Arsenicum 10M and Bryonia 10M on first exposure. This works very well when you have a suspicion of exposure as well. So I often get an email saying, hey, just found out that the friends that we were with have tested positive, what do I do? And so the prophylactic or the first stage of treatment for morning and evening daily in many cases stops it from presenting and eventuating. And then once or if symptoms begin to express, you increase the 2 of those to hourly. At the same time as those taken hourly, about 6 hours into the disease progression, the headache starts, and it's a very severe headache. There's a lot of pulsating feelings in the temples, feeling like the head is going to explode. It's a very severe headache that in many cases is only responding to Imigran and migraine medications. The ibuprofen and the acetaminophen is really not doing a lot. So the belladonna potency in the 1M every 15 minutes, normally we have to repeat that for 2 or 3 hours, but it actually takes the headache out of the symptom totality. So that's working well. And then once the headache and the body aches and fever resolve, then we pull it back again to morning and evening, working on that viral load. And then the fatigue is the last piece of it, and then that ear, nose, and throat congestion. So that's when we switch out to the Kali Mur 6X tissue salt, which is very easily to get available in health food shops and pharmacies. You can get that tissue salt. It doesn't need to be a homeopathic dispensary, and you just take that once every hour. In the middle there, there's a lot of itching and ringing in the ears. There's often some sneezing and some runny nose, but by comparison to Alpha and Delta, they're almost not even worth talking about. But they are part of what the Arsenicum remedy actually covers. So there's nothing else that's needed there. Okay, I wanted to speak about Ivermectin and Hydroxychloroquine. I haven't needed these in my practice, but I do advocate their use because I do think they're viable treatment options. What's important to understand, I think, about these 2 medicines is why they were taken off the market. The FDA the mainstream media did a very good job of poo-pooing these and criticizing these remedies, or these natural drugs. These drugs that have been used for years. They've been used to treat malaria and all kinds of dengue fever and Ross River virus, very aggressive and deathly diseases. So they had been in circulation, but the reality is that the FDA regulations only allows a vaccine to be developed if there are not medical solutions or drugs available to treat those things, which is why the media was part of the spin of getting these taken off the market. They were available, but they became black market items and other country items. And I know a lot of my patients were contacting me saying, look, can I get it from you? And I was not in a position to prescribe them, although I do advocate them. Hydroxychloroquine, 400 milligrams once every 2 weeks, was a brilliant prophylactic for those who could get it. But it wasn't advised for those who had any kind of arrhythmias or had some medication. So it does require supervision. And I definitely do not advocate trying to get these and take them without a doctor's supervision. But it's interesting that these things were inexpensive. They'd been in circulation, and Dr. Peter McCullough has done a wonderful job about explaining how the biggest issue we had here in America was that we didn't have treatment options. We were symptomatic. We got a test that said positive, and then the only option was hospitalization. And I think that's been one of the saddest and the most concerning things about the epidemic, and which has really meant that as homeopathic physicians and integrative doctors, we've really had to step our game up in our understanding, which is what fueled all of our collaboration and getting groups and Zoom calls and sharing our clinical findings, because it no longer was a viable option to just go and see your primary and get what you needed. Instead, they had their hands tied behind their back, and that's been incredibly disappointing. I think there's been a great loss of life and great suffering for hundreds and hundreds and hundreds of families who have had to suffer without anything on hand. And they've often had hospital outcomes that were far less than ideal. And in our family, and I know many others who are probably on this call, there have been premature death because the right drugs were not administered to those people. So it's been very sad. And I do think that there is a place for these in the continual understanding of how this virus is going to continue to variate, because this thing is not over. This is now part of the world that we live in. And I think understanding and getting availability of these drugs is going to be paramount. And there are two doctors or conglomerates of physicians here in America that you can get them through for a small fee on telehealth, and they will manage it for you. So if this is something that is on your radar and something that you want to do, then just send me an email in the next little bit, and I can give you those details directly, because they do have a place in this thing. The ivermectin was up until the vaccine process started, and that was really AstraZeneca, the first first talk of the AstraZeneca vaccine being established and starting to get tested and doing all of that. It instantly went off the shelves, and so eventually it's come back once the vaccine was started, that rollout in December 11th. So I like ivermectin, particularly for my high-risk patients who have had cancer who have things such as sarcoidosis and multi-system inflammations, because what we're learning is that the viral load continues, and this is that long COVID and that spike protein damage, that it does actually continue to create organ damage. So for the elderly, for patients who are high risk of this, and because of already chronic inflammation and comorbidities, ivermectin is a wonderful drug at preventing that cell and organ damage that is part of this long-term presentation. So I do think there's a really good place for that. I also like the C19early.com. I found that this has been a great resource of keeping up to date with what they're learning and what are the clinical trials that are current within COVID-19 treatment. So again, not prevention, but treatment. And this has been my biggest drum that I've been banging for the last 3 years, is that we must find and have availability to correct, accurate, and safe prescription treatment, whether it be homeopathic, whether it be the zinc and quercetin, whether it be vitamin C and vitamin D. We've got to be able to treat this thing instead of sit at home on our hands until we have to make the phone call to the hospital. So here is
And
my
just as
prevention protocol.
a quick interruption, you're at about 13 minutes to the hour, just so you have a time frame.
Thank you. Thanks so much.
Okay.
So
Yep.
here are my protocols for prevention and treatment from a supplement perspective, and I can send this on to you. I really like quercetin. It's easy to get. I like vitamin D3 in liquid. Just put it through few drops in water and drink that in the morning, and just make sure that you space your quercetin and your zinc apart, but by 1 or 2 hours, because they compete for space in terms of absorption. So the long-term stuff, I won't spend a lot of time here, but the long-term findings that, again, we're in the clinical observations of, we're just in, I'm scratching the surface with this. What is the real risk? The real risk is the spike proteins from the virus, and that they're also part of the vaccinations. They're damaging cells in the blood-brain barrier. They've also been shown to create damage in the vascular system, which is why we're seeing people who are vaccinated, people who are non-vaccinated, people who had Delta, who didn't have alpha. It's affecting all different age groups in the population. My earliest is a 24-month-old baby who had vaginal bleeding, all the way up to a 94-year-old who has had blood noses for months. So it's affecting all different demographics, and what we're seeing is that there is issues with the vascular systems from these spike proteins. So this is not about vaccination versus non-vaccination. This is about the COVID virus. This is about the spike proteins that are in the virus. And what we're seeing is these inflammation systemically. And so the muscle aches and pains, the breath and respiratory symptoms, the heaviness in the lower limbs, the blood clots, the blood stagnation, the varicose veins, and then of course all of the new shingles and chickenpox lesions that are coming out, herpes, rashes that are unknown. I'm seeing more and more of this as time is going on, and we're collating this data. What we need to understand about this is that we don't really know. We don't know what it's associated with, but it's definitely making our job harder, and it's making it difficult to differentiate as these new variants come out as to what is long COVID, what is the body's immunological response to the vaccine working on those ACE 2 and 3 receptors, and then how much of it is just the spike proteins really doing a good job of taking over the host. So this is another protocol that I'm using in my practice. So the Thuya in potencies 200 decm based on symptoms and severity of symptoms assists with transmission of others, because we're learning that this is not shedding from the vaccine, and this is not just viral replication. This is a level of transmission that we don't even know whether it's masks are protecting us. There's a lot of studies that are starting to talk about the blood-brain barrier. There's studies that are talking about that this is being used and transmitted almost the same way of a pheromone, where women who live in the same home start to menstruate and cycle together. So a lot of this is unknown, but we're seeing the clinical presentation. So cactus grand has been a great remedy in getting the blood clots and the internal bleeding under control. Cifalinum has helped for the mental emotional piece where there's chronic ulceration. This is a big remedy for support of getting the vaccination to try and work on these spike proteins in the first few days after the vaccination. I also use this with a lot of my elderly patients. Arnica has worked very well for people who have had a lot of bruising, pain and hemorrhage at the site of the vaccination. And anacardium has helped with the blood clots and the feelings of congestion in the vascular system and the circulatory system. So I use Arnica 6, Hamomela 6 and Hypericum 6 2 to 4 times daily. Now this is a great vascular tonic working against and protection against the accumulation of these spike proteins. And it's suitable for anyone who is experiencing those symptoms. but you want to make sure that they're not on any kind of blood thinners. This can be used for all those who are over 40 and then those who are high risk who are under 40, because this is actually affecting the pulmonary and vascular stuff in the legs, and then the spontaneous rupture of blood vessels. I'm seeing that more in the over 40 age group. Just some other quick anecdotal pieces before we finish up. The reality of mask wearing has meant that I've seen more mask dermatitis, acne, strep infections, and rashes. I use Silica 6X tissue salt, Apis 30, and Morgan Pure morning and evening. It does a great job of cleaning this up. And for strep infections, I'm using Streptococcus 3 times daily. Very good for people who have to wear the mask all day, who are seeing their skin deteriorate. Similarly, difficulty breathing within the mask, whether it be for young children who are in masks at kindergarten and school, or whether it's people in the workplace. For young children, I'm crushing 1 pill in their water bottle to be sipped all day of arsenicum 30. It's great to protect from and as a prophylactic from other kids and other people in the environment who may have COVID, but it also helps with the difficulty of breathing, that anxiety and feeling of suffocation. Aconite 30 works very well for people who can't get that deep breath and who are feeling that there's that constriction, they can't achieve it. There's that desire there, perhaps not just physically distressed, but they feel that there's actually an obstacle there and that they need to breathe it up. So the Aconite 30 is working very well every 10 minutes when struggling. And then as a prevention, a lot of people who are wearing masks for 6 or 7 hours a day, my children included, I just get them to take their mask off once an hour, put an Aconite 30 pill in, and it's really helped. And then for people who get overheated in the mask and who are struggling with wheezing, they feel like they're air hungry, they can feel like they have to get outside and take some deep breaths, Pulsatilla has helped and also helps with the hysteria. Okay, I think I did okay with time.
Yeah, we've got a few minutes left. It'll take, we'll have Aaron go ahead and he'll start unmuting people. And so while we're waiting to do that, that'll take him a minute or so. I've got a couple of questions for you. Now, I started with you back in, April of 2020, my wife, Deb, and I, and we got your prescriptions for every Monday and Thursday, taking the Nosode, and we were taking the Aconite. And then you gave us the treatment ones, the arsenicum, which you've talked about, and the Hepar sulf. My question to you now, for others that have, like me, may have done this, is should we start to hook up with you again and look at a revision in the prevention as well as the others if you were to get sick?
Yeah, absolutely. Again, they were the best information we had at the time, which is, I guess, the value in having me here again, and I appreciate that, is that we're learning more, and that the collective data universally from those who are prescribing every day in their practice, and there's hundreds of cases that we're using. So Hepasulf doesn't fit the picture anymore. We thought that was going to be a great remedy for the beginning of the pleurisy and the liquid of the lungs, and it did work with some patients. It definitely, I didn't have any hospitalizations, but it's not done what Carly Bish has done. Similarly, Bryonia was not part of the clinical presentation as well, or we didn't know the data in terms of reducing transmission. So I definitely think that the Thuya, the Bryonia, and the arsenicum is something that you can use prophylactically. You can reduce the spreading of it to other family members. So, and this is valuable. If one of you gets sick and say that it's your wife that gets sick and she's suffering, you can take this and not suffer with her.
Great. Well, I will contact you next week once we get back. We're heading off for the weekend, and then we'll set up a time for my wife, Deb, and I to meet with you. But there's probably other questions. So, folks, any other questions? Floor is open.
This is Tina. Thank you so much for your presentation. This is fantastic. I just have one quick question about oscillococcineum because it's so widely available, and I'm wondering if it's useful in any of this.
It's great for flu. It's not good for COVID. because it's not treating the severity of COVID symptoms. It's being used by some for the first stages of Omicron, similarly to what I use the Arsenicum and Bryonia for. It will definitely reduce your levels of suffering. So I'm not saying don't use it, but all it is actually working on is that viral load. It's not unique as a genus Epidemicus for the severity of COVID. So I'm not prescribing in my remedy in my practice because it doesn't have the punch of the other ones that we're learning about. But it is a good low, and the main thing is the potency, right? So because it's so readily available, it's in 6 and 30C potency. I'm using 10 Ms, which means that the recovery for a patient who's using mine, it can be the speeds that I've presented today, whereas a silicocynum, you're going to use it every day for probably 4 weeks and still feel unwell.
Wow, thank you. And any comments also about post-vaccine symptoms and homeopathics would be helpful.
Right. So I have specific protocols for what that looks like. Most of it is pulmonary, vascular, and neurological. I have protocols for all of those. That was not the topic of today, but sadly, I've got just as much collective data on that, and very happy to help you if you have that. It's a lot of them can actually just be done as when you know you have a booster, or you're choosing to get the second or the third or whatever keeps coming. There's a protocol to take for the 10 days surrounding that. So you start it beforehand, continue on the day, and go afterwards. That's been marvelous in terms of the side effects, or for want of a better word, the suffering afterwards. That's something that I'm using, and I'm doing a lot of prep work with those patients who potentially have the high risk of these vascular and pulmonary and neurological conditions, to prepare them and get them well. If you've ever had a vaccine and had issues with it, before you have the COVID vaccine, it's worth seeking out a homeopathic physician to give you a cleanup before you go and do it. It's been a day and night difference for patients in my practice and who have come to me for that reason. And protocols do exist, so do reach out.
Thank you so much. I'll be in touch.
Thanks, Tina.
Hi, I'm getting over the Delta variant now. I've got the persistent dry cough and hiccups still, but I'm over the worst symptoms. Anyway, I was wondering about quercetin because I didn't hear a lot about it, even though a lot of people made a big deal, a political issue about the hydroxychloroquine on both sides. The quercetin apparently is similar, but not as strong side effects potentially. And
Correct.
yeah, and do you find that it is as helpful with the Omicron as it was with the Alpha and Delta variants, or have you seen any more convincing research on its effectiveness lately? I
Great
didn't.
question.
Yeah.
Great question. I definitely started reaching for it as we were treating Delta, because we very quickly realized that this was not like last time, and that it required a lot more. I would not use quercetin individually, which is where my protocol puts it in with the zinc and the vitamin D3, and the vitamin C. I do think that it works synergistically in that way, but I also think it's difficult for us to understand the levels that are required. Same with the vitamin C. They're doing a lot of clinical trials in Mexico about IV vitamin C, which is up to 30,000 IUs of vitamin C, and they're seeing wonderful results of 4-day turnaround times even on the PCR test. They're seeing a positive change to a negative in 4 days just from vitamin C alone. I think the issue we have is that the FDA closes and the doors and ties our hands with these things, because there's another agenda here of pushing a vaccine, and they don't like us having the power to do it ourselves. And we've seen that with the Ivermectin and Hydroxychloroquine being taken off the market. So I do believe quercetin has its value, not so much in Omicron though, specifically to your question. I think Omicron is far less severe, and I think it doesn't have the multi-system that the quercetin goes after. Having said that though, if you're recovering from Delta, I'd definitely be taking the protocol.
Oh, I misspoke. I'm recovering from Omicron. I'm sorry. Thank you.
Oh, Omicron. Okay. Yeah. I don't think you need it so much in Omicron, just because it's just less multi-system involvement. Your body's not coping with as much.
Yeah. I have been using photobiomodulation for I guess the COVID fog or the headache, it seemed to have helped me
Mm-hmm.
get a good night of rest both times I used it, but it was late, so it's hard to say. It was late in the stages. It was the fourth and fifth day I used it, but
Mm-hmm.
it seemed to work. Yeah.
Okay, interesting. We've all got so much to learn from each other. Where, you know, this is the new world. We've got to collate this data.
I got a question.
All right. We have one more question, then we'll wrap it up. Go ahead.
Great. This is John. My wife and I are flying to Hawaii in a couple of weeks, so we were a little nervous about that, but we both have the vaccine and the booster and try to stay safe. Is there any prophylactic medication we should take on the
Yes.
flight? Or?
I would try and get some ivermectin. If you can, from a medicinal perspective, if you can get some ivermectin, that's going to be something on hand that if you get sick, it's going to work quicker than hydroxychloroquine. Hydroxychloroquine, if you can get that, the 400 milligrams once every 2 weeks is a wonderful prophylactic also. If you can't get that, my prophylactic of arsenicum tenem and bryonia tenem is also working really well for my patients who are traveling. And that just might be a simple, an easier way to, if you've got a homeopath locally who could supply those in those potencies, or reach out to me, I can send them to you. They are working very well at mitigating the viral load. And if there is an exposure, those remedies very quickly squash it, so it's asymptomatic. And then you've got a question of whether you can travel with those drugs, the hydroxychloroquine and the ivermectin. I'm not sure specifically what the rules are for Hawaii.
Okay. Can I call you later, or how do I get this medication?
Yep, just send me an email. Anyone who wants to follow up on any of this stuff. So I live now in Illinois. Previously, I was in Colorado. We moved to Illinois so that our kids could go to school. So we've been here a year. We have postage every day that goes out from our dispensary. So it's very easy to get a post bag out to you with standard post, or you can do overnight if you've got a time crunch. So that's very easy.
Okay, great. All right, I'll give you a call then.
Yeah, sure.
All right.
No.
Well, Nicole, we've hit that top of the hour, and I know you've got patients to go see, and many of us, we're starting to see people having to leave for the same reason. So thank you so much again for taking the time to meet with this group. Great presentation. I'm sure you're going to get several people contacting you soon. I'll be one of them again. So have a great day. Thank you so much. Bye, everybody. We'll see you next Monday.
Thanks again.
Thank you
Take
Thanks
care.
for
so
having
much.
me. Take care.
So long.
Bye-bye.
See you Monday, guys.
Bye-bye.